Today in this video we will be seeing about a topic in public health dentistry, that is Dental Council of India or DCI. This is one of the short answer questions. So DCI we will be seeing under the headings introduction, then composition, third terms of office and vacancies, and finally functions, rules and regulations. So first coming to the introduction. So the Dental Council was formed on 12th April 1949 and it is under the Dentist Act 1948. So it is formed in the year 1949. And who is forming the Dental Council? It is formed by the central government. So central government is the one who will form the Dental Council of India. Now coming to the composition, that is composition means the central government will consist of some members. So we will be studying the members under 6 parts. Like we will be separating the members or the composition of the council into 6. So first, it should have one registered dentist. Registered dentist means they should possess a recognized qualification. They should have a proper dental qualification, and they are elected by dentists who from Part A of registration. Part A of state registration. So what is Part A of state register is? Part A dentists are those dentists who are having proper dental qualifications and who are under dental practice, who are having a proper dental qualification. Whereas Part B dentists are ones who have experience of working with dentists but they do not possess a proper qualification. So all the BDS or MDS degree holders, all the dentists will come under Part A registered dentist. So the first we should have a registered dentist who is elected by dentists under Part A of each state register. Now second, one member who will be elected from the Medical Council of India. Third we will have further 3 subdivisions. Here from each group not more than 4 members will be elected. The first group, they can be either principals, vice principals, deans or directors of college. And from the same college, we will not select more than 1 member. So from one college, only 1 member is selected. Second, heads of dental wings of medical colleges. So heads of the dental wings in medical colleges who are training students for a proper dental qualifications. So from that heads we will be selecting a member. Not more than 4 members. That's it. Then third, we will be selecting 1 member from universities which are established by states. So universities which are providing a proper dental qualification, from each university we will be selecting 1 member from the state. These are elected by members of Senate of the university. So you can just remember not more than 4 members should be elected and 1 is from the principals, vice principals, deans or directors, and from the same college not more than 1 member. Second, from the heads of dental wings of medical college, and third, 1 member from each university or state. Now fourth, member to represent each state. So these members are nominated by the states. They are nominated by the state. They can be either medical or dental registered. They are nominated from the state governments. Next, 6 members nominated by the central government. In this, they have 2 rules, that is at least 1 dentist. At least 1. It can be more than 1. At least 1 should have a proper dental qualification and this person should be practicing or should be working in an institution training other dentists. So that is at least 1. And the other members, at least 2 should be in Part B of state register. So that is the rule for selecting the 6 members in central government. Now 6th, it is Director General of Health Services. Okay, so I hope you have understood the composition. So I'll just give an overview. First, it is 1 registered dentist who is under the Part A of registration of each state register. Second, is a member from the Medical Council of India. Third, not more than 4 members from each thing. That is divided again into 3. First, either principal, vice principal, dean or director of college. Second, head of dental wings of medical college. Third, 1 member from each university of the state. Fourth, the state will be selecting a member and it will be representing each state. From each state, 1 member. 5, 6 members who are from central government. And finally, it is Director General of Health Services. Now, we will come to the terms of office and vacancies. In this, we will be seeing, so in terms of offices, we will be seeing 6 points. So, the first point is, the member who is nominated or who is elected will have to be in the position for 5 years from the date of nomination or from the date of election. Second, this nominated member can resign his position by writing a letter to the president, and that position will all of a sudden become vacant. So, just writing a resignation letter, they can resign from their position. So, they can resign from their position. Third, this member, elected or nominated member, if he is not attending consecutive, that is next to next 3 meetings, or we have seen there will be vice principals or deans of colleges as member. If these principal or deans or directors have stopped working in that college, then they will be removed from that position. So, if they are not attending 3 consecutive meetings, or if the vice principals or directors have stopped working in that specific college, then their position will become vacant. Then fourth, if there is a vacancy, that is, an election is going to be held and a fresh candidate is to be selected. So, in that time period, in a short period of time, you will have a vacancy. So, in that vacancy, someone else can be seated for a short period of time till a new member is being elected. Okay, so for a short period of time, he can be elected. Now, fifth, members will be eligible for re-election or re-nomination. So, they are eligible for re-election or re-nomination. Sixth, no act which is done by council will be called in question on the ground without any defect in the constitution of the council. So, here we have studied about the introduction, then the composition, and then terms of office and vacancies. Terms of office and vacancies. Next, coming to the functions and responsibility of DCI. So, the main function or the main concern of DCI is to maintain a standard dental education throughout the country. So, the first main function is maintenance of standard of the dental education. And the other main concern is to register the qualified dentist and also eliminate any quacks or anyone who is providing a false practice. So, to register all the qualified dentists and to eliminate any false practitioners in the field. So, these are the main functions of DCI. So, to provide the function, it has some rules and regulations. So, the rules and regulations are of 8 points. We will see one by one. So, the first rule is there should be a basic principle for maintenance of a minimum education standard for the BDS. So, for the BDS degree, for the Bachelors of Dental Surgery, there should be a minimum standard of education which should be provided. So, there is a principle for providing this minimum standard education. Second, the colleges should have, all the dental colleges should have a minimum physical requirements. It should have a minimum physical requirement to run the college. Third, there should be a minimum staff pattern. So, for a college which has 40, 60 or 100 admissions, it should have a minimum staff to maintain the education level for all the students. Fourth, the staffs, that is the teachers, should have a basic qualification and also teaching experience to teach all the BDS and MDS degree students. Fifth, the college dental facilities, duration of course, selection of students, everything should be based on some rules. Sixth, the migration and transfer rule for students will be also determined by DCI. 7. The scheme of examinations for BDS and MDS students are determined by the Dental Council. The final one is dental curriculum. The time and subject specifications, the clinical program, field program, the syllabus, everything for both bachelors and masters of dental surgery. The field program, the syllabus, the subject specifications, everything will be determined. So, the dental curriculum is decided by the Dental Council of India. So, these are the functions, responsibility and the rules and regulations of Dental Council of India. So, I hope you have understood the topic Dental Council of India. See you in another video with another topic. Thank you.